It's the Stefan's curve. Again, this was all just from the 40s, and most people take these as truth, which I think they are. This is back to the basics, but being aware that even the basics you learned, they've evolved with time. And so looking at it, they said 5.5 is kind of the critical pH for hydroxyapatite, 4.5 for fluorapatite. And then they're like, well, wait a minute, maybe it's even less. Maybe you only need 6 for dentin or cementum, or maybe the numbers are different. 1940s, the way they were able to measure the pH was much more limited than the science now, where they're actually measuring areas and layers of plaque. And what's the exact pH right at the tooth surface? What's the pH a little further away and everything else? So this is still being researched and explored. It's evolving. And that's what I want to focus on too, is remembering the basics, but being aware that what we've learned evolves with time as well. Little curves on the bottom show that, I think, kind of healthy curve, have your meals or snacks, you don't spend a lot of time underneath. And then the unhealthy curve, it was interesting here that all the little dips that they showed, that's coffee everywhere. According to the curve, again, a little smaller on the bottom. So, and in the research too, they noted that you'll get 50 articles of literature talking about the acid and demineralization of teeth and its impact. For every one article you get about, well, wait a minute, how do we make the mouth more basic? That's the eat cheese right after that drop, and it brings your pH up faster in certain cheeses. So very limited on the prevention. Everyone seems to be focused on what's causing the problem instead of can we move further back from when the problem starts.